So today we will discuss the results of the third National Sero Survey. We know that the first one was done in May, June. Second one was done in August, September. And this is the third Sero Survey, which was done from December 17, 2020 to 8th of January 2021, pre-vaccination. Vaccination started on 16th of January. A general population of 28,589 individuals were included, and another group of 7,171 healthcare workers were also included. Now this survey was again conducted in the same 700 villages, wards, 70 districts from 21 states which were used or utilized in the first and the second round of the Sero survey done in the country. 100 healthcare workers per district were also evaluated, working in taluk CHCs, PHCs, and more importantly, we used the IgG antibody, the S1 receptor binding domain, which is the most sensitive test for a Sero survey, and this is the one which was used in the last Sero survey done in the United States, and it showed a prevalence of 14.3% in the United States. Now, what was the Sero prevalence in India in the general population? It was above the age of 18 years, it was 21.4%. Urban slums, it was 31.7%. Urban non-slum, it was 26.2%. And in the rural areas, it was 19.1%. And children between 10 to 17 was 25.3%. Next, please. Now, if in this slide, again in the general population, we can look at the age column and see that between 10 to 17, it was 25.3, 18 to 44, 19.9, 45 to 60, 23.4, and more than 60 was also 23.4%. And the rest, the next, this is in the general population of 28,000 individuals. Now, then amongst the healthcare workers, the overall Sero prevalence was highest overall, 25.7%, and it was not different statistically between doctors, nurses, paramedics, field staff and administrative staff, but it was highest amongst doctors and nurses of 26.6% as against the administrative staff, which was 24.9%. Next, please. So the message is that overall Sero prevalence is 21.5% of the entire population. Urban slum is 31.7%. Urban non-slum 26.2%. Rural areas 19.1%. So a large proportion of our population still remains vulnerable, and prevalence amongst healthcare workers is 25.7%. And more important to remember that prevention is the key. Vaccines are necessary, and we have to have no complacency in terms of use of masks, maintaining distance, hand hygiene, and social gatherings.